trust has plummeted in public health in this country over the last 3 years, the time of the pandemic. And this is a March 2022 survey performed by Harvard that was published in Health Affairs. But at that point, only a third of Americans trusted the CDC or the NIH or the FDA, all three of those big organizations. And that was, really declined. The trust was really down from before the pandemic. So I think the pandemic was really hard for people. I think there was a lot of responses that didn't quite make sense.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Our guest today is Dr. Monica Gandhi, a distinguished expert in HIV and infectious diseases. She is a professor of medicine at UCSF and the Associate Division Chief of HIV, infectious diseases, and global medicine at the Zuckerberg San Francisco General Hospital, overseeing significant research and clinical operations. Dr. Gandhi's unique perspective is shaped by her extensive work in HIV research and her pivotal role in public health education. Through her groundbreaking efforts, she has pioneered low-cost solutions for antiretroviral measurements and advanced treatment strategies for women with HIV. She plays a crucial role in public health education, mentoring early career researchers, and addressing the COVID-19 pandemic through her writing and public outreach. In this episode, we explore the state of people's trust in healthcare, her insights into the intersection of collectivism and health, and her vision for rebuilding authority in public health institutions. Enjoy our conversation. Well, thank you, Monica, for joining this morning.
Thank you.
So glad to have you. We've been talking about having you on our podcast. We have you last year in our symposium. But before we start, I always like to ask our guests to share a little bit about their background and what brought them to where they are today. So what brought you to where you are today?
Okay, well, so I am a professor of medicine at UCSF in the Division of HIV, Infectious Disease, and Global Medicine. I've been at UCSF for a long time. I went to Harvard Medical School, and then I came here from all the way in 1996. So I've been here since that time, 27 years. And I came to UCSF for my internship residency and then infectious disease fellowship because I was very interested in HIV. And San Francisco was the epicenter of the epidemic of HIV in the U.S. In the 90s, late 80s, early 90s. And so that's why I came here. And I've mainly worked in HIV research my whole career, but got pretty invested in COVID. And did a lot of messaging and writing during COVID as well, just because I'm an infectious disease doctor and I was trying to put it into place in history.
Mm-hmm. Yeah, and you did write a book.
Yes, I wrote a book for Mayo Clinic Press called Endemic.
Yeah. And I think one of the things that we brought you last year, we talked a lot about trust, and I think your book, The Endemic, the COVID, I think is really exciting. One of the things that I found these days a challenge about trust is challenge everywhere. It's not just in healthcare, but mainly, we've talked about healthcare, and COVID is part of like the inflection point, I feel, for a lot of people who used to trust and no longer trust, and it's problematic. What can you tell us about that a little bit?
Yeah, I mean, everyone has a different opinion about this, but I've really been looking at this trust issue a lot only because there's, been really clear documentation that trust has plummeted in public health in this country over the last 3 years, the time of the pandemic. And this is a March 2022 survey performed by Harvard that was published in Health Affairs, but at that point, only a third of Americans trusted the CDC or the NIH or the FDA, all three of those big organizations. And that was, really declined. The trust was really down from before the pandemic. So I think the pandemic was really hard for people. I think there was a lot of responses that didn't quite make sense. There were a lot of the prolonged school closures, I think, were really not making sense, only because we were watching Europe that didn't do that. We were watching different states that did school closures differently. And everything seemed to happen in the COVID response along political lines, as opposed to really clear scientific principles. There was a lot of what's called bad news bias in the US, a lot of focusing on all the negative things about COVID, not even when the vaccines came out, not a lot of celebration of them, sort of saying things weren't going to change. A lot of complicated mandates, both for masks and vaccines, even well past the time that other countries had stopped doing both mandates for masks or vaccines. So all of that polarization, all of that disparate responses by state, disparate responses by country, really just led to an erosion of trust in the WHO and the CDC and the FDA and the NIH. And what that's leading to is people questioning all vaccines, all childhood vaccines, for example. We're having a measles outbreak, 35 cases reported recently. 10 of them are in Florida over the last couple of weeks. We had a polio outbreak last year. There's just this erosion of trust can mean that people won't do things like take vaccines, which is a very basic public health measure, or give them to their children. And we're in a real bind right now with trust. And I know a lot of people will say, health officials will say, oh, it's all everyone else's fault. It's misinformation, it's disinformation from really bad players. But it's not just that. It was public health, I think, not being as clear and as science-driven as they should have been, as opposed to making recommendations around political lines. And I do think it's up to public health to help increase that trust, to work on it.
Mm-hmm. And you mentioned a little bit before, your role, you're leading the HIV here. Is there some playbook that we can learn? That I feel like there's some correlation that maybe we can learn from that, maybe can overcome these challenges, because it needs to be addressed, this whole trust thing.
It does. I think the idea that it'll just go away is a real problem because, without a true addressing of a problem, it may not go away. So, yes, I mean, actually, the book that I wrote called Endemic for Mayo Clinic Press was essentially about the interactions between HIV and COVID, how I think HIV could have informed COVID better, the good lessons that we learned from HIV, the problematic ones, which we should have taken, which we should have not taken. And it really is kind of drawing a comparison between the two epidemics. And that comparison is because HIV was the last major new infectious disease that came on the scene. I mean, it started first described in 1981, so 40 years ago. And there was a lot of problems with the response, but there are a lot of good things with the response. And I think what it was trying to say, this book, was what are the lessons that we could have taken. And one lesson was what I call harm reduction. Harm reduction, the principle is that you're so eager to do something in public health that you just want to impose measures on the public without knowing if they work or not, and also sometimes using coercive measures. That doesn't reduce harm. It can increase harm. Like interventions like the prolonged school closures increased harm to children who really need school. It's really essential for them. So because of that, where could we just have an itch to do something, but unless we have good evidence to do it, we shouldn't. And the question is, where did we reduce trust by not using harm reduction measures, which harm reduction means whatever you do, try to minimize the harm of your intervention.
And I think also sometimes I tend to give people the benefit of the doubt. I think at that point, when we have the COVID, many people don't know what it is, the implication. There's no vaccine at that time. A lot of people died from it. And so for people who wants to protect the public, they feel like they need to do certain measures. And with times, there's new information coming along. And I feel like sometimes people just like, well, this should not have been happening. But then people forget that at that time, there's no information.
Yes, but the problem with that is that we actually knew pretty early on some major facts about the virus, and other countries were adapting to the science as it came out. But the U.S. was being really political. And no one can say that the U.S. had the best outcomes. They just didn't. For a highly industrialized country, we had outcomes that we should not have had. And so we need to take a look at, is there anything that we did wrong? Because we want to go into the next pandemic with trust. And so what could have been wrong? Well, very early on, We knew it was spread by respiratory. It was a respiratory route of spread. It didn't need all that deep cleaning. That seems simple, but like that can decrease trust to do continual deep cleaning 2 years later. It does. People are like, I already know this doesn't work. There were very clear evidence from Wuhan in February of 2020 that this happened to be a disease that was less likely to affect children or make them very sick. It really was an age stratified risk. The older you were, the more likely you were to become very sick from COVID. There's some very important immunopathology reasons for that, but that isn't true of all diseases. I mean, measles is worse for the very young. It just happened to be for COVID. But again, there'd be a lot of, so other countries adapted quite quickly to that. Scandinavian countries who were left in politics opened their schools early. But here are the left states, the states that were more left kept their schools closed, and the states that were more right kept their schools open. So it was, things were happening along political lines and not around scientific lines that made people suspicious. And we should have just adapted with the information as it came out. Vaccines did stop transmission early on with the Alpha variant. We had every right to say that. That was true. And then after a while with the Delta variant, they didn't stop transmission. So the WHO put out a statement in May of 2022 saying we can't mandate vaccines any longer when they don't stop transmission. But we didn't adapt here in the United States, even though other countries had adapted on vaccine mandates earlier. So again, you have to keep it up with it. It's really, really fast moving. And we didn't adapt quickly to the science. We stayed kind of true to our political tribes in our responses.
Mm-hmm. And to some extent, in the U.S. now, the political polarization is getting worse and worse. It feels that way, at least based on what you read. And healthcare is really, they don't care whether you're left, middle, right. But at the same time, sometimes I was talking to somebody who is serving for somebody in the Congress, and they say that a lot of the things that you hear on the news are more like performative, but actually behind the scene, they do some work together. And I'm thinking, how do I know what works really behind the scene and what really, because the one that we see is only the ones on the news. What can we do as healthcare who work in a healthcare company or innovators to make a difference? Because we don't want people to die for something that can be avoided, and we want people to not get measles and polio again.
Right. And no, it's a really good point, because I have talked to people at the NIH, at NIAID, because I'm really involved with the NIH. I'm an NIH-funded researcher, and I've been on different councils. And they will say to me what you just said, that behind the scenes, actually, Democrats and Republicans are working together much better about thinking how to fund public health agencies and thinking about the importance of NIH. In fact, historically, we've had increases in the NIH budget that are higher during Republican administrations than Democrat administrations, because everyone recognizes the importance of health. But what appears on TV is that there's massive polarization between these parties on who they want to support, and that there's threats to public health funding agencies made by specific Republican candidates, for example. And that is really problematic, because it makes it look like everything's in disarray. But I don't think that's necessarily true. In fact, the cuts that were proposed to NIAID, which were cut, that NIAID is the infectious disease organization at the NIH that funds research, those proposed cuts have not yet come to play from the House, even though they have been proposed. And so I think we should realize instead that we're all in this together. Health is always kind of a collective enterprise. Infectious disease health is even more collective, because these are contagious illnesses. Actually, measles is highly contagious, the most contagious virus probably. And so something like having measles in our country and losing our elimination status, which we've held with measles since the year 2000, is really problematic and really not good for anybody, Republican or Democrat. So we need to keep on refocusing our messaging on that we're all in this together, especially with infectious diseases. You know what ended up happening with HIV is that it was we had kind of an isolationist perspective in the US for a long time. And then the Republicans really got together and formed PEPFAR. And what I mean by Republicans is this was formed under the Bush administration, George G.W. Bush. This was in 2003. It was called the President's Emergency Plan for AIDS Relief, PEPFAR, and it's been one of the most highly successful global health programs ever created, 20 years and counting, that really worked on HIV globally, because the point that was being made is anything that happens in another country with an infectious illness affects us here. And it has been so highly successful. It was absolutely bipartisan. And we need to go back to those kind of ideas that health is not divided along political lines. And I do think that people and public health officials were trying to keep people safe at the beginning of the pandemic. They should have just been more nimble about changing to data, changing recommendations with data, and a little more concerned about people's concerns about civil liberties, because DJ Henderson talked about this, who eliminated smallpox. He said, you want the public to be on board. And if you're too coercive, they're not going to be on board with you. So lots of mistakes that could have not been made. And that's really what chapter 10 of my book is about, kind of a new pandemic playbook, what we should be doing for the next pandemic that's more along the lines of old pandemic playbooks. It's a 10-point plan, but it really shouldn't be polarized. And I don't actually, like you just said, I don't think it's as polarized as it appears on TV.
But it's hard to not believe what you see on TV because it's right in front of your face, and people do say things that is very kind of,
inflammatory. Yeah.
But again, you hear about the whole anti-vaccine. It's been there even before pandemic. Now it's getting bigger and bigger and growing. And how do you convince them that it's not the path?
Yeah, we don't want this to get bigger, this anti-vaccination sentiment. It used to be actually more on the left that people wouldn't vaccinate their children. The idea was that they thought this was more natural not to, or we should use different remedies that aren't vaccines. And now the sentiment, anti-vaccine sentiment, has moved more to the right politically, and that's what's changed during COVID. It kind of went from one group to another, and with some groups always being more anti-vaccine, like very highly religious groups that attributed vaccines not to their faith and not being consistent with their faith. But I will say that this is all about really simple education, in the sense that a very good example, 1963 is when we got the measles vaccine. Prior to that, we used to have 4 million cases of measles a year and 450 deaths, mainly among children, in the U.S. every year. After 1963 plummeted, we've barely seen measles deaths, thank goodness, because of the vaccine. So it's that cleaner communication about what it was like before. We don't want to have it go back to what it was before. Polio was very well known during the FDR administration because Franklin Roosevelt suffered from polio, and we don't see those ill effects of polio anymore, paralysis, because of the polio vaccine. So it's those kind of going back to history and reminding people that these vaccines have been one of the most sort of miraculous things in modern medicine. And we now no longer think, or we shouldn't be thinking about these old diseases. We can go on to new problems. And I think maybe an apology from public health, I would say, for COVID, to just say, you know what, it was all over the place. The response was all over the place. It was different in different states, different in different countries. We weren't sure what we were doing. Sometimes we were political. Really sorry. I know it was hard. And anything that we can do to increase trust. I just know there are ways for public health to act really modest and humble and say, we didn't know everything. And even now we're going to try to listen to our constituents. But let me remind you of the history of vaccines. They're really important.
Yeah. And I think, and how do you convince that to happen? Because nowadays everything will be on record. You can play that again and again, and maybe that's why people don't want to say on record.
Yes. I mean, I think the way to convince people is to remind people that infectious diseases was the leading killer of humankind for years and years and years before both vaccines and antibiotics, meaning we now got reminded of infectious diseases during COVID, but actually we think more about heart disease or cancer or other diseases that plague mankind. But infectious diseases, we actually really, really got to a state of better control for measles, mumps, rubella, diphtheria, tetanus, pertussis. These were terrible, terrible infections that led to morbidity and mortality. And you don't even hear about them anymore. Starting to hear about them with these outbreaks, but you don't. And it used to be the scariest thing, really high rates of infant mortality from cholera, from other infectious disease outbreaks, plagues. Just remind people that the history of humans are intertwined with pathogens. And the only way to get away from that is to create immunity in humans. And it is safer to get immunity from a vaccine than it is to experience the illness. In the case of measles, have terrible cough, congestion, coryza, which is runny nose, conjunctivitis, which is red eye, fever, and can get really sick. So I guess it's reminding people of history.
And I think especially with, like you're saying, we don't hear that many people with measles and polio. And so human is like when you don't see it, it doesn't happen to you, people that you know. You forget. And then this whole thing about vaccine, how do you gain people trust for something for preventive, right? I think our healthcare is about fixing.
Right. It's really interesting what you said, because this is just also a human trait. Like, we forget an ounce of prevention is worth a pound of cure. And it is so much better to prevent, vaccine preventable diseases. And yet it's not right in front of us. And yes, you're right. I think we forget that's a very human trait. I think that one way is, I don't think we should get away from mandatory vaccination in schools for highly contagious infections. And we really haven't. Actually, Florida still does require mumps, measles, rubella vaccination. It's just that there's been more applications for exemptions. Sometimes mandates do work. And I think in the case of school entry, that's important for highly infectious diseases that have a disproportionate impact in terms of child morbidity and mortality. So I think we do use mandates when necessary, and I think that's necessary. I think the other is really good education. I think the third is reminding people of history. I think the fourth is saying that COVID was really hard for everyone for a number of reasons, and sorry if we contributed in any way to your life being difficult over the last 3 or 4 years. And fifth is I do think that this idea of prevention, which is more prevalent in other countries, we should remind people how much money that we spend at the end of life care and at the end, as opposed to like going back to the outset, prevention is worth a pound of cure. This is going to take a lot of work, but community-based messaging helps. Messaging from the communities that are affected, not someone coming in, swooping in that doesn't look like the community that's having some hesitations. Learn from HIV. HIV community-based messaging works. Community members from the community messaging to the community you want to affect change in.
Do you think as the society now, as you're saying about the community, society in many parts of the world is moving towards individualism? It's not so much about community. And I had this conversation with somebody who was asking me, why do I get vaccine in the beginning of COVID? And I said, it feels like I'm just doing a little something that hopefully can benefit the community. Not so much, sure, if I stay at home all by myself, maybe I never get the COVID, but I don't want to do that. But if I do my part and everybody do their part, then maybe we can get rid of COVID. That was my thinking when I first do it. And more like, it's my role as part of the community rather than just focusing on my individual.
Well, I think you're right. I was just rounding in the hospital at San Francisco General, which is the county hospital in our system at UCSF. And I had a visiting doctor from Uganda with me. And she kept on saying to me, where are people's families? Where is their community? And I said, this has been hard. Like, not only has COVID been hard, but there is this kind of streak of individualism, and it's lonely in this country. It's lonelier in this country. There is no doubt about that. I was just in India last week, and it's a completely different feel. And, the Surgeon General of the United States is talking a lot about this community and loneliness, and what the U.S. has forged in terms of a rugged individualism that can also lead to great loneliness. I think we do have to work on community and social togetherness. And I think the COVID pandemic didn't help because we told people to stay away from each other for quite a long time. So yes, we do have to take responsibility for each other. And I agree with you that this society in particular in the West is more individualistic than most. But vaccines is kind of a collective responsibility for your own health and then for others. So I would say you're absolutely right. And it takes really good messaging. It takes really like compassionate messaging, right? Like much more kind and compassionate messaging than top-down messaging to get people to like understand the need for community. I think it's been super lonely time. People are kind of a mess over the last 3 or 4 years. They hit each other on television, at the Oscars, all sorts of things are happening. We need to get back to civil and more communal-based behavior.
So is there anything that's happening right now that is addressing that?
Okay. Well, number one, we also are, there's 2 wars going on and, it's just really difficult right now. Like just the world seems a lot of turmoil. The Surgeon General, Vivek Murthy of the United States is really focusing on this, on community, on taking people out of isolation, on older people being in community. He's just going around the country and talking about it really nonstop. The CDC is not talking about it as much as I can see, but the NIH is also talking about it, the National Institute of Mental Health. There's been an infusion of money into the Mental Health Institute to say that we need to address our mental health crisis after COVID. So I would say the NIH and the Surgeon General are working on it, and we can probably work on it more locally and in the state.
And in terms of building the trust?
The trust, I actually, frankly, I really do believe that we need to apologize. I know that everyone's like, well, what are we apologizing for? It was complicated. I always apologize to patients in the hospital. It really was not, I always apologize to them. I'm just so sorry you're going through this. The word sorry to me is very powerful. It just conveys a sense of true compassion and empathy. I'm just really sorry. And I can't think of another way to increase trust without just saying, I'm sorry. And not like immediately saying, but it wasn't my fault. But just saying, I'm sorry. It just expressing a kindness to someone that it was hard.
Listen to what you said. It's almost that people want to be acknowledged, but how do you acknowledge more the public, right? It's what you're doing with your patient is one-on-one, but I feel like with the challenge with the vaccine pandemic, it's more like public.
Yeah, the people who have to apologize are actually really heads of public health agencies, like just because they're in the public eye. And again, they may not have even been there. They didn't cause this distrust, but it's just saying, I'm sorry. Like it has to be really public people who say, I'm sorry, in my opinion, like not public health officials that weren't in the public eye. People have to come out and say, I'm sorry. I know it was really hard. It was really polarized. It was all over the place. I'm sorry.
I feel like at this point, if we can bring back trust, it can solve many of our problems, but just don't know.
Yeah, I hope so.
I don't have the power to do that.
Yes, I really, really hope so.
Yeah. So, well, thank you for your time. Thank you for sharing the insight about building trust and the challenges that we have and that we are facing. And I hope more people trust other people more. I like to believe that they tend to be good people. They do their best because they care. And sometimes the way to do it is not always you agree with.
Yes. Thank you so much for having me.
Thank you for tuning into today's episode of the Health Technology Podcast. We hope you found the conversation insightful and inspiring. If you enjoyed this episode, please take a moment to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us continue bringing you the latest in health innovation. Stay connected with us on LinkedIn and Twitter for updates on upcoming episodes and more. Until next time, keep pushing the boundaries of what's possible in healthcare. I'm Christine Minato, and thank you for listening.